Here at Texas Health, we offer a really multidisciplinary, comprehensive program. We offer things for patients preoperatively, through the operative process, and then post-op, where they're taking that journey and making it a whole new lifestyle. One of the most important things to keep in mind is whether they're really ready to make a change, because it truly is a lifestyle change. There's no magic wand here. It's not just a pill you take and suddenly you're going to be thin, healthy, and happy about everything in life. You still go home to the same issues. You still struggle with some of the day-to-day things. And so we want to make sure they're really ready to embrace a new lifestyle.
Deciding what operation to get done is a very deeply personal decision for most patients. I would characterize it in two ways. One is the medical aspect. Really, the operation you choose should be able to address the kind of weight loss you're looking for. Not every operation is made equal, and so the different operations will result in varying degrees of weight loss. So it depends on what your weight loss goal is. The second aspect is really a personal decision, in the sense that some folks have seen family members have a particular operation like a bypass or a lap band, and they're familiar with the lifestyle and things that come with that. And so they may gravitate towards that particular option. Of course, the last thing is the medical aspect, where if you're trying to deal with medical conditions such as diabetes, high blood pressure, sleep apnea, joint disease, there are certain operations that do better than others.
The bariatric surgery today is not the bariatric surgery of a decade ago. We've been doing this a long time, but we've continued to improve with robotics and with laparoscopic approaches. It's drastically changed the risk profile. I think more importantly, we need to remember that not treating obesity has extenuatingly dangerous risk. Hypertension, diabetes, sleep apnea, they all increase people's risk for cancer and heart disease, and we know that the risk is at least six-fold that of someone who actually treats their obesity.
If I was to choose one word to describe why Flower Mound is the ideal place to have weight loss surgery, I would say quality. This hospital believes in quality. They have quality people, they have quality staff, quality equipment, a quality facility. There's an interest in making sure folks are well taken care of.
Well, the nice thing about a comprehensive medical and surgical weight management program is that we have ongoing follow-up. So after surgery, one of the things the patient can look forward to is support groups, classes on nutrition, support through exercise programs, support with behavioral support, with things like ways to handle cravings, ways to handle stress eating, things like that. So we offer a lot of support afterwards for the patients so they can continue to be successful. We do some group exercises, we've engaged with certain gyms, and we've really put together a program that we think's helped support the patients right here in the community where they live.
The most satisfying thing as a bariatric surgeon is to hear, number one, the stories people tell you about the effects of losing weight. It's very satisfying to have folks come in, not really believe that they could ever beat this struggle of obesity. Number two, not really believing that it's not their fault that they are where they are. There's a lot of criticism, there's a lot of shaming, and when folks come in and feel like there's no way out, it's very satisfying after surgery to see them come back and see them reap the benefits of the hard work they put in. I've had patients tell me that they're just happy to be able to kneel down in church again to pray. I've had patients tell me they can bend over and tie their shoes. I've had patients be able to keep up with their grandkids or their kids. It's things like this, the stories I hear, that really inspire me to move, to keep doing what I do. I think so. The most satisfying aspect of this really is the human element. The fact that you're changing people's lives in a very real way, sometimes in ways they didn't anticipate on a daily basis.